Hello, I'm David Brick. There is a crisis in primary care. There are too few clinicians, there's not enough time. Patients wait far too long to be seen, and when they do finally get to see their doctor, the visits are far too brief. The patients feel rushed, the doctor can't do everything they want to do to help their patients. And the relationship between doctor and patient, which we know is so important to patient health outcomes and to the doctor's job satisfaction, suffers. And it's only getting worse. But you already know all that. In fact, you probably know more about it than I do. I studied economics in college. After that, I studied a certificate program in addictions counseling. What do I know about primary care? All that stuff that I just said about the crisis in primary care, I got all that from newspaper headlines. So why should you have to listen to me talk about it? Because I know a way to tweak primary care, or I know about a way to tweak primary care that can help. For the past year, at Brigham and Women's Hospital's Phyllis Gen Center for Primary Care, I've been one of a handful of undergraduate level interns who've been improving patient care, helping primary care physicians to do more in less time, growing and improving the pool of future primary care clinicians, and advancing our own education and career, all at little or no cost. The secret to this impossible miracle is that we ignorant interns have been doing real patient care. How did this happen? Who should we sue for letting kids care for patients? The person to sue is my mentor, Dr. Joji Suzuki, an addiction psychiatrist at Brigham and Women's, and a senior fellow in the Center for Primary Care's Innovation Fellows Program. But he didn't mean to be so negligent. He was innocently trying to improve care for patients who abuse opioids like heroin and prescription painkillers. These patients are severely underserved. They need a lot of help, they use a lot of resources, and a lot of primary care physicians think of them as very difficult to treat and very demanding. And a lot of primary care physicians just don't feel comfortable treating them. So Dr. Suzuki wanted to give the PCPs more support. I'll make myself available to advise them, he said. I'll have a specially trained care manager see the patients regularly to supplement the PCP's treatment efforts. I'll recruit medical student interns to talk with the patients regularly over the telephone, serving as health coaches to improve communication and strengthen the patient-provider relationship. But when the health coach position applications came in, some of them were actually from undergraduates who somehow had found out about the position and applied. And somehow, 2 of those undergraduates were the best fit for the position. And Dr. Suzuki did select them, and a year later, me, and 6 months after that, 2 more undergrads. And so far, we haven't broken anything. In fact, when we surveyed the PCPs who've worked with us, all of them said that we've helped them to use their time better, that we've improved the care that their patients are getting. None of them said that we'd be more helpful if we had more training. And half of them wanted us to work with their other patients as well. I think that's a super idea. I think we've stumbled upon something that can really help this crisis. So I want to share with you a taste of what it is that we interns do. Now, we do a lot of things to help our patients and clinicians. Probably the most important are our telephone conversations with the patients. Today, I'm calling Dorothy. Now, Dorothy is an older woman who everybody likes. She's a true extrovert. She thrives on conversation. She'll talk your ear off if you let her. but you won't mind because you'll be laughing so much. Lately, Dorothy's been missing her appointments. And as much as we try, we haven't been able to reach her on the telephone. But we keep trying, and today, Dorothy picks up. We catch up for a bit, and then I mentioned to her that we've had a hard time reaching her. Maybe I suggest we should be trying to call her at a different time. No, she says. She's been really depressed, she's been isolating, and for basically everybody, she hasn't been picking up the phone. But she asks, please, keep calling, keep leaving messages, because even if I don't pick up the phone, I hear the messages. It tells me that you're thinking about me. It tells me that somebody cares. And that really makes a big difference. We also talk about her lower back pain. It's been getting worse, and it's really made it a lot harder for her to get out and visit with people, which is so important for her. I ask her thoughts about seeing a psychiatrist or a social worker, and she says she'd be fine with both. Another important thing that we interns do is plan and guide our weekly team meetings, which include Dr. Suzuki, our care manager, Dr. Matthews, and the interns. Because the two doctors' time is so short, the interns pre-select a handful of patients to discuss, to focus the doctor's time and attention where it's most needed. Today, I bring up Dorothy. I describe her missed appointments, her worsening depression, and her worsening pain. Dr. Matthews has some ideas about how to adjust her pain treatment. We all agree that a psychiatry referral could be helpful, and we also all agree that her PCP should be updated about all of this. And that's another important thing that we interns do, is email the PCPs about their patients. Because the PCP's time and attention is already spread so thin, we strive to write emails that are concise, organized, and not too frequent, but that convey the necessary information that the PCPs need in order to best care for their patients. Dorothy's PCP replies to my email and thanks me. He's been worried about her. Over the next few weeks, he and I will collaborate to help Dorothy make and keep an appointment with a psychiatrist. Now that's my own experience. The other interns, unlike me, are pre-med students. So I asked them about their experience with us. They told me how important it is for a pre-med student to get hands-on clinical experience and how difficult it can be to get that experience. They raved about the time they get to spend working directly with our patients. They also told me how satisfying it is to be not only learning valuable patient care skills, but to actually get to use those skills to make a difference in people's lives. There are a lot more like them out there, students who, with enough mentoring, have the time, ability, and motivation to make a meaningful contribution to patient care. Now, if you want to help make that happen, or you just want to know more, come drop by our poster at the poster session. I'll be there, along with one of my co-interns. We're both eager to share with you our experiences, hear your thoughts, and if you want, talk about next steps that you can take to help. Like, for example, following us on Twitter, joining our LinkedIn group, or starting a student organization at your university. I'll leave you with this. On some slow days, Dr. Suzuki sits down with me and we talk about my career. Over the course of the internship, I've honed in on social work as a career. Now, I didn't used to think that I could be a social worker or that I'd want to be. But this internship has taught me a lot about what I like and don't like, what I'm good at and not so good at. And this fall, I'll be applying to social work master's programs. Now, I know these things change, but I'm thinking that I'd like to work in a patient-centered medical home, a primary care clinic. So, plus one primary care clinician. Thank you.